Hello, my name's Kaylee, and this is my Sbar report for 2/23/22. So today I was at the Wound Care Center at Cedar Crest, and this is my first day at the experience. So background, who did I work with today? I worked with primarily two nurses. So Linda and Megan, they were both very nice and sweet and really willing to teach, which I appreciated. What did I do today? So I basically learned what the day in the life of an outpatient wound care nurse was like, which was an awesome experience, getting to see from start to finish what they do. So they have a whiteboard with the patient initials on there correlating with a nurse for that day, and they kind of will like rotate on and off, like between nurses of who's getting what patient. So the nurses will do a very small they'll do a really small prep on the patient either the night before or the morning of to get an understanding and take a look at the wounds from the beginning of the process to where they are now. So they look at how the wounds progressed. And then they'll look at how the wound is being dressed, what they're using on it, etc. And just to kind of get an understanding so they're not going in blind. And so then we would go in and introduce ourselves. The nurse would ask if there was any updates with allergies. And then she would do a neurovascular assessment. She would check for edema. She would measure the wound, chart a little bit, and then she would also apply lidocaine to the wound and saturate it so that when the nurse practitioner would come in to debride it, the patient wasn't in as much pain. So the nurse practitioner would take off the yellow slough with it looked like a scalpel, but it was kind of circular. And she would then debride it, and then she would then talk to the nurse and discuss if they want to stay with the plan of action or if they want to change it. So it was cool to see the collaboration there. And then the nurse would then redress the wound, and we would send them on their way to make a follow-up appointment. Was this experience more observational or were you able to participate? So it depends. One nurse, I was able to redress a wound, and that was a great experience. The other nurse thought we were just strictly there to observe. I did try explaining a little bit, didn't really have the opportunity or much of it. So I guess that's one of my recommendations, which I'll get to. But the assessment action portion, what course objectives do you think you met today? So I think I met 1 and 3. So applying concepts of family and culture to the care of families and communities, so like a therapeutic relationship. I believe I did that when I introduced myself to them, saying my name is Kaylee, I'm a senior nursing student at Cedar Crest College. And then also a lot of them during the debridement would kind of wince or grimace in pain. And so, well, not in pain, but they would kind of be kind of woozy. It's not the greatest experience. So I would try to talk about anything and everything to them so that they can get their mind off of it. And then, so just kind of developing that rapport, the trusting relationship, making them feel comfortable in a very uncomfortable situation. I think I was able to do that. And then objective 3, exercise independent judgment in establishing priorities of care for families and communities. So one of our patients, it kind of came into question if he did have a home health care nurse, but the nurse wasn't exactly doing things in a timely manner in terms of ordering the medications, ordering the dressing materials. So that was kind of a part. And also the patient, there was a question brought up of if he can afford the ointment that we were giving him, because it was a few $100s. Even with insurance, it would be $100 for a tube of ointment. So, and it was something he needed. So it was kind of cool to be a part of that conversation. and just seeing how finances play such a high role in patient care. And it's one of those things where, like, I knew about it, and in inpatient and acute care, it is in the back of my mind, but it's never in the forefront. But in this setting, it was just so different. And to kind of understand that, and just kind of know that that patient's going home like directly after this, and we don't know the environment they're going home to. We don't know their financial standing. Like, that is our job when we are talking to them and developing that relationship, to kind of get a gauge of, are they going to be able to afford this? Do they have someone taking care of them? Do they have help? Do they have support? So that is our job as the nurse, and our responsibility to understand that for the patient. And it was just interesting to see how much of a priority that was in this setting. So that was really cool. And then for recommendations, I basically would just speak up, because I just think there was a little miscommunication. The one nurse thought that we were just there for observation. I am glad I got to do some things. I just wish that I maybe portrayed it a little bit different. So, but yeah, other than that, it was a really good day and a good experience. So thank you.